Hello, how are you? And good day to everyone. My name is Doreen Mola Moracha, the amazing host of this particular YouTube channel. And if you are new here, please do not forget the red button. Click subscribe as we always do. And if you have been returning, continue doing what you're doing because very soon we're going to be on TV. I'm going to give you that tea in another video, not today though. So today I am joined by an amazing guest all the way from Ethiopia. I don't know whether is Ethiopia a republic or a monarch. Okay, we shall learn about that in a few. But I am joined by an amazing doctor all the way from Ethiopia, and I want you guys to tune in, give this video a like, nice comment, and do not forget to share it. Shari, welcome to the channel. I have taken 3 days to learn your name. I am not very confident that I have learned it.
Try it.
So, no, please.
Okay.
Do not put me in this spot.
Okay.
So, welcome to my channel.
Thanks so much.
And on this channel, I focus on matters HIV and SRH and a little bit on non-communicable diseases. But today we are going to specifically talk about HIV. And now that your country is in 2014,
2014, yes.
You are still in 2014.
Yes.
I don't understand how that works, but it is what it is. So I want you to, I saw that the population living with HIV in Ethiopia is around 1 million people. And I want you to bring that to us. How is the access to services? Are ARVs free like in my country? How does prevention work and all that? And because, what is your total population?
So as a population, with the recent census?
No, with everybody, yeah.
With the recent census, it was around 110 million. But it's been a while since that census has been done. So I think we reached about 120, 125, right about now.
And out of those, just 1 million are living with HIV?
No
cases.
That's really important.
Okay, so, but still, 1 million is a small population considering you are a large population. And I have just realized that you did not say your name, so please first say your name.
Alright. Hello everyone, thank you for having me on this channel, Dorian.
Yeah.
My name is Aemon. I am a practicing physician in Addis Ababa, Ethiopia. I work at the tertiary hospital known as Dr.Aemon Hospital, which referral patients come to us from all across the country to have better care and management for their health.
Thank you so much, Aemon. So you have said, because according to Google, it says that only 13.3% between 2010 and 2007 were living with HIV. So up until now, because we're now in the medical field, how many people are living with HIV? Like, is it still the 13% or it has been high?
So we did a good campaign when it comes to HIV, right around the early 2000s. And there were flyers everywhere, there were campaigns being done in each university. So people were aware. Even though we were still lacking in the rural areas, people were aware. So that's when we saw a decrease in the amount of HIV cases within the country. But after 10 years or so, after the campaign was launched and everything's winded down a bit, we saw again a rise, a peak of where it is now. I think we've seen the highest cases now, and especially centered around the capital, and as well as some cities around the Gambela region and the southern nations. Because when we've been taught about this in medical school, we actually had an infectious disease specialist who was talking about this. People there, their culture, so if you marry a wife and if you die, your brother or your next of kin is supposed to marry that woman so that she's not left abandoned. But usually the person dies due to an HIV/AIDS infection. And due to that AIDS disease, that person might die unknown, and that wife would have to carry that virus and she would transfer it to the next of kin. And that's why there is rampant, yes, around that region.
So there's one community in Kenya that used to practice the wife inheritance thing as well. But with the time, I think they've been sensitized and all that, and now they do not practice it as much. But you told me that you have at least 1 million known cases.
Yes.
So what are you guys doing in the HIV response to get the unknown cases?
So it's community outreach, right? Within the health, the local health centers. We call it PICT, which is patient initiative, with regards to self-testing, counseling of HIV, and that has been successful in cases of maternal causes. For example, when women come for a pregnancy screening, now it's usually part of the basic lab investigations that we send out, and we usually go around, and it's usually a cheaper test to do because it's centered around public health, and also the community outreach. Since we're building more local health centers in much remote areas, I think the outreach is getting better. But as I say this, there also needs to be a culture in which people, are motivated to do that. But the stigma is still there. I think the awareness has been created in that infections are not transferable just being around near people or just having skin-to-skin contact with them, but not bodily fluids. But I think the stigma that person carries AIDS, even I think the person knowing that person is positive would lead to a heavy psychological weight on them. So the culture is still there, the stigma is still there. I think that's the problem. But the government's trying to reach out to the community by building local health centers within remote areas.
So in Kenya, recently there was a report saying that girls between 15 to 24, at least 98 girls get infected with HIV every week. And ideally, over the years in our HIV response, most of the population that is affected with HIV is young people. So is that the same case for Ethiopia, or it's ideally the whole cohort, the whole population from?
Yes. Much more. I think Kenya and Ethiopia share a lot of similarities when it comes to health.
Yes.
And that data, we don't have it. That study hasn't been done in Ethiopia. But if we were to have that data, I think it would be quite similar to that number, because we also have 70% of the population being youth between the ages of 15 up to 35, and we also have the issues of not having good sexual awareness or good sexual practices in which people use contraception properly, they practice safe sex. So, and that is usually the age group in which we see a lot of infections within the hospital as well. That's when we see a lot of mothers coming in with new infections. That age group is usually the part where, and usually women tend to get the side of the bad side of
they're more affected.
They're more affected with HIV. Yes.
So in terms of stigma, you mentioned a little bit about it earlier. When it comes to stigma, and you actually put in the aspect of culture.
Yeah.
So apart from culture, is there anything else? Is there misinformation, or it's just a cultural aspect?
Yeah. So misinformation, in the early 2000s, I think it was there. I was a kid back then, but you could still hear people. You remind yourself of what they're saying, and now you learn medicine, and now you're practicing, and you say that was really wrong what they were saying, right? And those rumors sort of, those are the things that continue in our society, having lasted for a while. But I think as more people get educated, as more people get to know the virus itself, they tend to shy away from those rumors. But I still think that the stigma exists because, number one, our country is really religious when it comes to both religions, both Islam and Christianity. So, a person having been diagnosed as HIV positive or living with AIDS, that person would automatically, you would be indicated as having premarital sex, or you would be in a place where you're practicing, if not only premarital sex, but not safe sex. And that's usually an outcast within our society, because the religious people, everyone is proud of their religion, and they don't want to associate themselves with that sort of behavior. Not just being afraid of, you being HIV positive and not wanting to be near you, just the idea of you having been put in that situation gives them not a steady ease when it comes to approaching you. But when it comes to misinformation, I think there are still people who are not educated. The majority of the country, I can say, is not educated. And when it comes to HIV/AIDS, they're usually learned by a relative that's been dealing with the virus, or a neighbor, or a person who's close to them. But other people, I think, in schools, they might lead to those informations being given out and them having proper conception about the virus. But there are misconceptions and there are misinformation still going on, which I have to tell the patient, no, this is not the actual case, but this is how it's supposed to be. Especially when it comes to mother-to-child transmissions.
In fact, I was going there to mother-to-child because you mentioned about mother-to-child transmission, and in Kenya we were doing very well. Now, when we were in your year, that is 2014, we were doing very well. Yeah. And then I do not know where the rain started hitting us from, but right now we are like at 6% of a mother-to-child infections. Right. And considering the amount of prevention methods, the information that we have right now, mother-to-child, I believe, should not be happening in 2022, but for some reason it is still happening. So how is the situation of mother-to-child in your country?
Yeah, so I can say clearly, like when I was rotating in the obstetrics and gynecology rotation, and when I was a medical student as well, we used to see a lot of PMTCTs not being done properly, and proper, maternal care was not given due to the fact that she's HIV positive as well. But when you see the progress within the next 5 years, like we've seen, there is a problem in prevention and there is a problem in early screening and diagnosis. But when it comes to having those people who are already HIV positive and convincing them that it's safe to have a baby and how to have the baby as well, I think we've built that structure more. The strategy was built more on when she's diagnosed and when she's about to have a baby, how can we deliver this baby safely? But there is a problem still within the whole country, because the outreach, when you look at the AHF outreach, it's usually based in 2 cities within the Oromian region and within the capital. So you can see like how the government would have a hard time reaching out to about 20 million people, trying to say that it's safe to have a baby with HIV/AIDS. That's not the problem. The problem is they don't even know they have it. That's why I disagree with the number 1 million. I think it's much more than that, and that's why we're not having proper mother-to-child transmission rates go down, because the mothers don't even know. People live with HIV/AIDS. They carry HIV/AIDS all throughout their life, now knowing they have a lot of babies, and from them babies, a lot of them might be exposed to the virus. And I don't think the problem is about not them getting treatment and not them having safe deliveries, but I think the problem is not knowing in the first place that they carry the virus.
And do you ARVs free in Ethiopia?
Yeah, that's a very complicated question, because it's supposed to be. Right? It's
in Kenya they're free.
Yeah.
In most public hospitals.
In most public hospitals. Yeah. It works the same way. Healthcare in Ethiopia is mostly free when it comes to, especially we have this, community-based insurance in which we all put in money so that everyone's funded. And if you have that, of course, it's free. Majority of the things are free. And of course, the AHF also gives us free, I think they care about 13,000 of the 1 million people. They reach out to 13 or 15,000 people and give them ARVs to properly care for them. But you can see how much of the rest of the population doesn't have it. Yeah. And usually our ARVs are in shortages. When it comes, all medications are in shortage when it comes to our country. Yeah. So in times of war, in times of crisis, there are people living with HIV/AIDS and that don't want to continue because their CD4 counts are still low. Yeah. And those people would be in a pressure that they would have to pay and buy the medication either from a black market area or from a pharmacy that dispenses this not for free but with money.
So still, it's not technically free.
Because
in Kenya, if I walk into a comprehensive care clinic, I'm giving my ARVs for free. If I need post-exposure prophylaxis, it's free. If I need pre-exposure prophylaxis, it's free. So ideally, everything in the HIV response is free, unless I'm in a private facility where now I have to pay a little bit of money. And now that you say that ARVs have you have to pay, I'm now wondering what happens to PEP and PrEP.
Huh?
PEP and PrEP, the prophylaxis for prevention.
Yeah.
Do you guys pay for them as well?
No, usually those patients are usually enrolled in a program, so there's the AHF. So that was already covered, and when it comes to prevention, everything, when it comes to the patients getting the care of not going into the spectrum of AIDS, I think that would be covered with most patients freely because they're already enrolled in a program.
Yeah.
The problem that we're facing is for the ordinary man that's just found out that that person is diagnosed, or the already woman, the everyday woman that is living with HIV/AIDS, and they're not in a place where those programs are available. I find it hard to say it's free because when you say something is free, the availability needs to be there.
Yeah.
So if the availability is not there and people are desperate, they go where it's available. And usually those spots are usually not free of costs. Yeah. But you can Google it, obviously.
No, Google. Let me tell you, Google can tell you one thing, but what exactly is happening on the ground is a whole totally different thing. Because they can tell us 1.5 million Kenyans are living with HIV, but when you do like the data and then you find out it's not 1.5 million, then those are two different things.
Exactly.
So I think I have come to the end of my video. And I do not know whether I have forgotten to ask you anything.
Okay.
So thank you so much for agreeing to do this interview. As you go to Ethiopia, continue being the good doctor that you are. And I forgot to mention that me and Aemon are part of the One Champions. One Champions is a cohort that was just selected via party in East Africa from Kenya and Ethiopia. And we are fighting extreme poverty, infectious diseases, which is the other one.
Preventable diseases by the year 2030.
Yeah. And basically it's by an organization called One, like ONE, just one the number. And so that is how we met. And please continue subscribing to my channel. Like this video, leave a lovely comment. I will leave your social media handle so that if they follow you, please follow him. So thank you guys for watching towards the very end, and I hope to see you again next week. Bye-bye.
Bye.